Hello, everyone. I'm Dr. Marie McNeely, and I am excited to have you joining me today for episode 587 of the People Behind the Science podcast. This week, we are revisiting our interview with Dr. Rebecca Richards-Kortum from October 31st of 2016. Now, listeners, Rebecca is a bioengineer who has dedicated her career to developing and disseminating low-cost technologies to improve healthcare and access to healthcare around the world. Some of her work includes point-of-care screening for oral, esophageal, and cervical cancers, low-cost sensors to detect infectious diseases, as well as novel tests to diagnose HIV in infants in under-resourced settings. Her innovative and high-impact work has been recognized nationally and internationally with numerous prestigious awards and honors. And during our interview, Rebecca talked about her career path, her research, and her life outside of science. So listeners, get ready to be inspired by Rebecca in this episode of People Behind the Science.
Every day, discoveries are made that will change our understanding of the world around us. Dr. Marie McNeely is here to bring you the brilliant minds who are making these discoveries so they can share their incredible stories and take you on an amazing journey. Welcome to People Behind the Science.
Hello, everyone, and welcome to another episode of People Behind the Science. Listeners, today I am thrilled to introduce you all to Dr. Rebecca Richards-Kortum. So, Rebecca, thank you so much for joining us today. How are you?
I'm good. How are you?
I'm doing quite well, and I'm excited to chat with you about all the exciting things you have going on in your life and your science. But first, I do want to tell our listeners just a little bit about you. So listeners, Rebecca is the Malcolm Gillis University Professor of Bioengineering and Electrical and Computer Engineering at Rice University. She's also director of the award-winning Rice 360 Institute for Global Health, as well as founder of the Beyond Traditional Borders program at Rice University. Rebecca received her bachelor's in physics and mathematics from the University of Nebraska-Lincoln, and she went on to receive her master's in physics and PhD in medical physics from the Massachusetts Institute of Technology. Now, Rebecca has received many awards and honors for her amazing research, including very recently being named a MacArthur Foundation Fellow. So congratulations on this.
Thank you.
Absolutely. Now, some of her other recent awards include the Pierre Galletti Award, which is the highest honor from the American Institute of Medical and Biomedical Engineering, also the Lemelson-MIT Award for Global Innovation, the Michael S. Feld Biophotonics Award from the Optical Society of America, and Rebecca is also a member of the National Academy of Sciences, the National Academy of Engineering, and the Academy of Arts and Sciences, as well as a fellow of the American Institute for Medical and Biological Engineering, the American Association for the Advancement of Science, the Biomedical Engineering Society, the Optical Society of America, and the National Academy of Inventors. And the list could go on and on, Rebecca. I'm quite impressed. Now, listeners, Rebecca is here with us today, though, to talk about her experiences in life and science. So today we want to get to know you both scientifically and personally. So can you start by telling us how you spend your time when you're outside of your role as a scientist?
Oh, sure. So my favorite thing to do is hang out with my kids. And when I'm not hanging out with them, I'm a big runner. So you'll often find me out running in the early morning.
Awesome. So do you compete in races or more leisure run?
Well, I like to run races. I'm a total back of the middle of the packer, but I really enjoy getting out for half marathons and marathons.
Gotcha. Very cool. Are you getting your kids into running as well?
I have two little girls who are adopted from Ethiopia who are 10 and 6, and they love running. So we've gotten to do some neighborhood 5Ks together. It's been a lot of fun.
Oh, that's awesome. Well, it's great to hear a little bit about your life outside of science, but I want to chat about your work next. I think you do some incredible work. So can you tell us how you describe what you do to someone who's not familiar with your field?
Sure. So I'm an engineer, and what I like to think about in my lab is how can we develop technologies that can not only improve healthcare, but also can improve access to healthcare. So that means thinking about how you make them less expensive and how you make them appropriate to use in places that may lack access to technology.
Definitely. Well, I think these are critical issues across the world. So very exciting to hear more about what you're doing as we go through the interview. But I want to take a little moment here to talk about what motivates you. I think there's so much to get done in the life of a scientist that sometimes it can almost feel overwhelming. So I'm one of these people who loves to have little motivational quotes and sayings to keep me going, to remind me why I'm there. So do you have a favorite quote that you can share with us today?
I would say, actually, I don't have a favorite quote that motivates me, but really what motivates me is when I have a chance to go to a healthcare setting, and particularly one in an under-resourced area, and just see the limitations that exist every day in so many places of the world. Every time I do that, I just come back so much more inspired and dedicated to keep doing what we're doing here in the lab.
Absolutely. Well, I think that is a phenomenal way to get inspiration, kind of seeing where the impact of your research is in the world and the potential for you to make more impact. I think that is definitely something that will keep you getting out of bed every day and going to the lab.
Yeah.
So can you tell us a little bit about some of the people who might have inspired you or motivated you along your journey? Did you have any role models or mentors who you looked up to?
When I was growing up, I was really interested in math and science. They were definitely my favorite subjects in school, but I grew up in a small town in the Midwest, and there just weren't a lot of role models for scientists. So when I went to the University of Nebraska, it was the first time that I had an opportunity to interact with people who did science for a living. And it was just like I was exposed to this whole other universe of possibility. It was really so exciting and so amazing. And it was the department chair in the physics department, Professor David Selmayr, who invited me as a sophomore to come and work in his lab and do research. And that was an experience that just changed the whole direction of my life. I'm so grateful to him.
Absolutely. I can definitely relate to that. I know for me, college was the first time I ever really even met a scientist or was sort of had that on my radar as a career. Mm-hmm. So can you tell us where your interest in science and math and physics began?
I always had an affinity for science and math, and I really love how you can use math as a logical way to think about understanding science and to think about characterizing the performance of new technologies. So for me to get to come to work every day and do that, it's such a privilege.
Absolutely. So can you remember what was maybe the first time where you started thinking about pursuing a career in science? Was this something you had a dream of from a young age, or did it come later in college maybe?
It really came later in college. When I was growing up, as I said, I didn't see really people pursuing careers in science other than high school science teachers. And so when I started as an undergraduate, when I started as a freshman, I was in the teacher's college and I was planning to become a high school math or science teacher. And then I took freshman physics, and I was so fortunate. The instructor of that class was just this amazing teacher, Professor Paul Burrow. He made physics so engaging, and he really encouraged people that liked it to think about majoring in physics. And again, that was just one of those moments where the right person was really there at the right time for me to show me what was possible.
Definitely. I think some of these early teachers and professors can have such a big impact on a student's career. So I love that story. So can you tell us where you went next? So you started getting interested in science in college. What are some of these key steps that took you to where you are today as a very successful scientist?
As an undergraduate, I really debated between, did I want to go to graduate school or did I want to go to medical school? Even right up until the spring of my senior year.
Oh, really?
Yeah. And finally, I got accepted to the medical physics program at MIT, which was an opportunity to do research, but also do a little bit of medical school so that you could appreciate that translational perspective. And for me, that was so important because I find my personal motivation in seeing firsthand clinical needs. And so when I was offered the opportunity to go pursue that program, then I knew that that is exactly the right path for me. So I'll never forget the day I learned I was accepted into that program. I was just beyond excited that I would have the chance to combine those things that I loved. And I had a wonderful experience in that program.
Excellent. So then can you tell us what brought you from there at MIT to where you are today at Rice University? Was there a postdoc in between, or how did you get this current position?
No, so I went straight to a faculty position. So this was the late 80s, early 90s. At that time in engineering, it wasn't that uncommon for people not to do a postdoc and go straight into a faculty position. So I started on the faculty at the University of Texas in Austin. I was in the Department of Electrical Engineering and doing research in the biomedical area. And then about 12 years ago, I had the opportunity to move to Rice as department chair in bioengineering. So I've been here ever since, and I really love it here so much.
Well, it's wonderful to hear. Now, can you tell us what is something that you are working on right now that you are so thrilled to be a part of?
The project that I'm most excited about right now is a project that addresses a challenge that's very near and dear to my heart, and that is the challenge of trying to improve newborn survival. So if you look at the leading cause of global child death today, it's actually complications of preterm birth.
Interesting.
Yeah. And so the world has done a good job of bringing infectious disease under better control through childhood immunization programs, for example. But we haven't made very much progress to improve outcomes for newborns. And if you think about what made the difference in the United States, it was really having a regional system of neonatal intensive care units, NICUs, and all of the equipment that you would find inside a NICU. That if you go to a community hospital in Africa and you go visit the newborn unit, what you will find is very little equipment. You will typically find maybe one physician, a couple of nurses who are working really hard to do the best that they can with the equipment that they have, but it's just not enough. Mm-hmm. And so what we're trying to do is develop a comprehensive set of technologies that are both affordable, but also sufficiently rugged to work in those environments there that can address all of the needs of newborns so that we can turn the tide on this big problem of poor outcomes for tiny babies.
Absolutely. Well, I think this is phenomenal work, but I know this development of low-cost healthcare equipment is so critical for these developing nations or places where they just don't have the resources. But I could also see the application for even places who do have the resources just because the cost of healthcare is so high. So are you kind of working in both areas?
Yeah, absolutely. We're interested in improving access to healthcare in whatever setting inequities exist. And there are many, many inequities within our own country and within my own state and community. And so I think often from an engineering perspective, the challenges are slightly different in those two settings. So I do a lot of work in Malawi, which is a small country in Southern Africa. And when I go there, hospitals might not have consistent electricity or consistent access to clean water or consumable supplies. And so you would approach design of equipment in a way that is mindful of all of those constraints. Whereas if I'm designing something to work in Houston, we have power, we have water.
Right.
Right. But we still have many patients that don't have access to life-saving technologies. And so there we're more thinking about how can you reduce cost and how can you move things closer to the point of care so that we could put things in the hands of community health workers, for example, or in the hands of nurse practitioners, make them easier to use, make them more automated, make them less expensive so that then we can open up access to a broader group of patients.
Certainly. So we mentioned some of the NICU equipment, neonatal intensive care types of things that you'd be working on. Are there other examples of types of technology that you're developing right now?
Our lab has a big focus on trying to improve early diagnosis of cancer and precancer. And so, for example, cervical cancer and oral cancer are two types of cancer that we're working actively to try and help improve early detection. And we know if we can identify precancerous lesions, these are things that can easily be treated in ways that are very inexpensive and that are completely curative. So you actually prevent people from going on to develop cancer. And so it's really cost effective and it improves outcomes for patients. And that's an example of something where I think the same technology can be helpful here in Houston. It can be helpful in a place like Malawi because we're really providing something that's not currently possible with existing technology.
Absolutely. Well, I think this is phenomenal. And I've read a little bit about your program, the Beyond Traditional Borders program. So can you tell us a little bit about what this gives undergraduate students an opportunity to do?
So what we do in Beyond Traditional Borders is we work with clinicians who are providing care in low resource settings, and we just ask them to identify the things they wish they could do, but they're not able to do because they don't have the right tools or technologies. And then we turn those into design challenges for multidisciplinary teams of students. And they work then over the course of a semester or over the course of a year to actually develop a solution. And then they have the opportunity to take their prototype back to the place that contributed that idea. And so we've sent students to Malawi, we've sent students to Brazil, we've sent them to Rwanda, we've sent them to Brownsville, Texas with prototype technologies where they're able to demonstrate and get lots of really useful feedback about what still needs to be improved. And in some cases, they actually are able to implement their technologies in those settings. And they get to see firsthand the benefit that the device they've been working so hard on could have in that setting. And they just come back, I think, really different people. They come back so inspired, both to continue their project, but also to think about what they might do in their own career in a different way.
Certainly. Well, I think this is different from really any other undergraduate programs that I'm familiar with. So this is a really cool thing that you have going on there. And I mentioned that you are the founder of this program. What prompted you to develop it?
So when I first came to Rice, we were thinking here about what we should do with our capstone design course in bioengineering. And this is a year-long course that mostly all engineering students do a capstone design project. And my colleague, Maria Oden, was teaching that class. And I had just been to a conference where I heard someone from Northwestern University talk about how in their capstone design course, they were having students design affordable prosthetic devices, and they were implementing those in countries where there were many amputees because of landmines that had been left behind. So I came to Rice, I was talking to Maria, and together we really thought, wouldn't it be amazing if we could structure this capstone design course around challenges that come from developing countries. And we've been working together ever since to implement that both in the capstone design, but then more broadly for students from all disciplines here at Rice.
Very cool. Well, great to hear more about this innovative program. And I think so far, Rebecca, we've talked about a lot of the great things about your career and your journey to get to where you are today, but we haven't yet touched on a lot of the struggles and challenges. And I think every scientist has a good story or two about a failure, a challenge, a struggle. And it's interesting to hear how people work their way through these challenges. And it's perhaps helpful to our listeners out there who might be going through the same things or preparing for them in the future. So do you have a story that you could share with us today?
Of course, every scientist has many stories of failure because failure is such an integral part of doing science and of doing design. And what I tell my students is that you can learn so much by looking at examples of failure. And one example of that is a challenge that came to us from pediatricians who were providing care for pediatric patients that had HIV and AIDS. And so these children needed to receive the proper dose of liquid medication. And there were a lot of concerns that their caregivers might have limited numeracy skills. And so they wouldn't necessarily be able to draw up the proper dose of liquid medicine using just a traditional oral dosing syringe. And so they wanted a tool that they could be sure that the patients got the right dose of medicine. And so we thought it was a great problem. And so we assigned it to a team of senior students. And they came up with a solution that it worked, but it was so complicated.
Really?
Yeah. So imagine like a bottle of lotion that has one of those hand pump dispensers.
Uh-huh.
That's basically what they made to go on a bottle of medicine. And you had to take it off and take it apart to actually set the dose.
Oh, geez.
And then you screwed it on top of the bottle. And then these medicines are pretty viscous. Mm-hmm. So this would fill up with medicine and it would need to be cleaned. And so while it did deliver the proper dose, everyone that they demonstrated it to was like, oh my gosh.
Too much work. Yeah.
Yeah, we don't want it. Go back to the drawing board. And so then what we were able to do actually was to reassign it to several teams of students. And when they were able to look at what didn't work, I think it helped them brainstorm about how they could come up with more effective solutions. And the winning design turned out to be a really simple little C-shaped plastic device that you just insert into the barrel of the syringe, and it limits how far you can pull back the plunger. And so to switch it out, they're color coded according to the dose. So to switch it out, you just like literally push it out of the barrel and slip a new one in. And you can make them for pennies. And when we demonstrated this one to our collaborators in Swaziland, they said, we love it. We want 200,000.
Oh, wow.
Then we had a different problem, which was a very good problem to have.
The production problem. Yeah.
Exactly. But, I think it's a great example of how often failure isn't really failure because it's the step before success. And it's often in looking at what went wrong that you find the inspiration to figure out the right solution.
Certainly. And I love this idea of getting feedback from the people who will eventually be using your technology, your science, or discovery. So I think that is a key step. And I love this story also because sometimes the low-tech, simple solution is just the best, right?
Absolutely. Simple is always better.
Right. As scientists, I think we have a tendency to overcomplicate things sometimes. I love this story. So thank you so much for sharing it with us, Rebecca. And we don't just want to talk about challenges that you've surmounted. I do want to chat about the successes. And I love that the first story had a happy ending, but is there another story of success that you can share with us?
One of the things that we're so excited about is one of the first technologies that we've developed to try and help improve newborn survival. It's something called a bubble CPAP machine. And so this is a device that is used to treat preterm babies that struggle to breathe because their lungs are immature. Here in Houston or anywhere in the United States, we would treat that condition using something called bubble continuous positive airway pressure, or CPAP. And essentially, all you do is you place a little soft set of rubber prongs in a baby's nose, and you blow in a mix of air and oxygen at constant pressure. And what that does is as babies exhale, that additional pressure, it just keeps their alveoli from collapsing. So preterm babies, they lack surfactant in their alveoli, so the surface tension is much higher. And it takes a lot of energy for them to breathe in and breathe out because that surface tension is so high. So this extra pressure can just help get them through that first week of life until their own body starts producing surfactant. And the challenge is that bubble CPAP devices for high resource settings cost about $6,000.
Oh, wow.
Yeah, they require infrastructure that doesn't exist in many African hospitals. And so in our program, our students designed a very low cost bubble CPAP machine, and they used as the flow driver 2 aquarium pumps, which I thought was a brilliant idea.
Yeah.
So they said, we need something that's going to pump air out at the right flow rate, and it needs to run forever, and it needs to be very cheap. And they immediately thought of aquarium pumps. With their first prototype, which they made for $160, they were able to show that it delivered the same flow and pressure as the system that's used here at Texas Children's Hospital.
That's impressive.
Yeah, we were so excited about it. So we took it to Malawi, and the clinicians there really liked it. And so we got permission from the Institutional Review Board there to do a clinical evaluation of their prototype device. And we were able to show that for the premature babies that suffer from this condition, that survival improved from 24.5% up to 64.6%.
That is huge.
Yeah, and it's actually very similar to the improvement that was seen when CPAP was first introduced in the United States.
Well, congratulations on that amazing success.
Yeah, thank you. And so then what we were able to do was we were able to actually commercialize the technology. So it was licensed to a company in San Francisco, and they've now taken it through international regulatory approval, and it's now being used in 23 countries actually to save newborn lives.
Wow.
And one of the student inventors who invented the technology here at Rice, she now works at this company as the product manager for this new line of neonatal technologies. So it's been exciting to see both the success of the technology, but also really exciting to see her success.
Absolutely. Well, it sounds like students and researchers in your field really have great opportunities to be creative and innovative in developing these solutions to these medical problems.
We've been working very closely with the University of Malawi now to try and implement the same kind of program within Malawi. So we've been working with our colleagues there at the School of Engineering, which is located actually right across the street from the medical school in Blantyre, Malawi. And it's been wonderful to see now Malawian engineering students actually going in to the hospital and the medical school there, identifying local challenges and developing local solutions. So I think this model of engaging students in designing solutions to challenges in their own neighborhood can really work anywhere.
Absolutely. And really having that visible impact. You are really changing the lives of people, not 10s, 20s, 30 years down the line, but today.
For me, it's being able to have that impact on that kind of horizon is why I'm in biomedical engineering, because I really wanted a career where I could more directly see that kind of impact.
Absolutely. Well, Rebecca, again, congratulations on all of these successes and the amazing work that you're doing in your field. And I know we've chatted a little bit about what occupies your time when you're not doing science. And I love to talk to scientists about what books they're reading. I know it can be hard to escape the literature sometimes and get away from the manuscripts in your field, but I'm always trying to incorporate more fun reading time in my life. So do you have a book that you recommend to me and our listeners that we can check out?
Oh, I'm just opening up my Kindle. So I'm a big reader. And I'm terrible at remembering names of books.
Me too.
So I'm just looking at what I've read recently that I loved so much. I loved Lily and the Octopus. Have you read that?
I have not. I've never heard of it, actually. Tell us about it.
So it's by Stephen Rowley, and it's about a guy who I would say is somewhere on the Asperger spectrum, who is very attached to his dog, and his dog develops cancer, his dog Lily. And it's about how he says goodbye to her in a way that helps him engage more with the world. It's a wonderfully, wonderfully written book.
Sounds like you need a box of tissues next to you when you're reading it, though, perhaps.
Yeah. I loved The Invisible Life of Ivan Asienko.
Really?
You read that?
I've heard someone recommend it, but I've never read it myself.
I read that recently and loved it. So it's about an orphanage in Russia, and Ivan Asienko is an orphan who's there in the orphanage, and he's, I think, maybe 15 or 16 when the story takes place. And he's very intelligent, but he tries to hide his intelligence. And then a girl his age comes, and she has leukemia, and he falls in love with her. It's the story of then what happens over the next few months. It's also a very sad story.
Oh, geez. Do you find yourself gravitating towards these tearjerkers?
I like sad books, I have to say. I find it very cathartic.
That's true. It kind of puts things into perspective a little bit, makes you reflect on maybe the things going wrong in your life aren't so bad.
I did love Lab Girl. Have you read Lab Girl by Hope Jaron?
Oh, I've actually interviewed Hope on this program, but I haven't yet read it.
Oh my gosh.
Yeah.
You have to read Lab Girl. It's so good. Okay, I'm going to go listen to the interview with Hope because I loved her book so much.
Awesome. Well, I will definitely add these books to our reading list on our website so our listeners can browse them when they're in search of their next great read. And we've talked about some of your amazing work, some of the things that you've done in Malawi. And I know travel is a big part of the life of a scientist, and you've done a considerable amount of traveling in your career. So, Rebecca, is there one trip that maybe sticks out as just the most memorable travel experience that you've had for science?
Yeah, it would have to be the first time I went to Malawi, without a doubt. I had been teaching a course in bioengineering and global health I think I taught it twice before I went to Malawi. And so I certainly had read a lot and taught students about challenges in global health. But actually experiencing and observing those challenges firsthand had a very big impact on me personally. And I will never forget the first time that I went to a newborn unit at a hospital there and saw the need, but then just literally down the hall saw a room that was full of broken donated equipment, which was exactly the kind of equipment that was needed in that newborn unit, but wasn't designed to work in that environment. And the irony of the fact that those two things were so close to one another.
Right.
It really made me come back to Houston knowing that I was going to change the direction of what I did to really address that in a meaningful way. And it's taken, honestly, it's taken the better part of a decade to get to a point where I feel like we're just beginning to see that a solution is possible and that a solution is within reach.
Gotcha. So can you take us back to one of these medical centers in Malawi and maybe give me and the listeners a sense of what it's like? How big are they? How many people are there?
And this was at a central hospital, so it would be like an academic medical center. And the newborn unit typically might have 60 babies who are admitted there. And their moms are basically there with them to provide basic care because typically there might be 3 nurses on staff during the day and fewer nurses on staff at night. Mm-hmm. And it's very common in settings like this for the power to go out for part of the day, for there to be stockouts of basic necessities, like they might be out of a type of antibiotic one week, or they might be out of pediatric size infusion sets. So they have to use adult size infusion sets. And so just things that we completely take for granted every time we go to the doctor or visit a hospital, you can't assume are there.
Absolutely. Well, I think in your describing these situations that you've seen, the places that you've been, you can just tell how much you care. And I think this perspective of science as sort of cold, hard, calculating people is often wrong. I think we're very passionate. We care about what we do. We're funny. We have amazing personalities in so many cases. And I love breaking the stereotypes of scientists on our program by kind of showing people the human side of science and scientists. So do you have any stories that you can share us of maybe funny or fond memories or even a quirky tradition that you might have experienced that really showcases this?
So our CPAP project has been funded by two really important grants from the U.S. Agency for International Development, USAID. They have a program called Saving Lives at Birth, which allows scientists to propose a solution to a challenge that would reduce mortality around the time of birth. And they started this program just as we had completed our prototype of CPAP. And so we submitted a proposal and we got invited to come to the final stage of the competition. And they run it like it's science fair for grown-ups.
Really?
Yeah. So you go and have a poster about your project and the judges come and interview you and like they're holding.
To get a blue ribbon if you win.
Well, so they're holding a stopwatch and timing your answers.
Oh, man.
Yeah. They're very strict. And then at the very end, they actually have a public ceremony where they call up the winners on stage.
Oh, cool.
So stressful. So we were super fortunate that we got funded in the first round. We got what's called a seed grant. And that gave us money actually to work for a year. And we hired these three wonderful CPAP nurses in Malawi, Florence, Chrissy, and a woman named Sister Partridge. And these nurses are really tough ladies and they care so much about babies in Malawi. And so we submitted the next year, we submitted a renewal grant that would allow us to scale up significantly our CPAP program. And I was in Malawi about a week before the competition and I had lunch with them and they looked at me and they said, "So are we going to have jobs next year?"
Oh, geez.
Yeah.
No pressure, right?
Yeah. So then I went back to Science Fair for Grown-Ups round 2. And the thing that was stressing me out most actually is if we don't get it, I'm going to have to tell these nurses that we didn't get it.
And that they don't have jobs next year.
Yeah. Oh, and unfortunately we did get it. And so then I let Jocelyn, my colleague, the CPAP inventor, I let her share the good news with the nurses.
Aw, that's awesome.
Yeah.
Well, I think this really highlights some of the stress on scientists, your specific situation, but in general, people who are working for you in the lab, they are depending on you to get funding in order to support their jobs.
Absolutely. You're like a small business person, really. You have to make the rain that allows the crops to grow.
Absolutely. Well, now we've talked about some of the fantastic technology that your group has been working on and developing to help so many people out there. But I'm wondering if we give you everything, Rebecca, if funding, staff, technology, feasibility, most of those barriers that are in the way as a scientist were out of the way, what is the one question you would want to answer, the one piece of technology you would want to develop?
I want every newborn unit in Africa to have the tools that they need to make sure that babies don't die of preventable causes. And that's where I'm focusing the next 10 years of my career trying to do.
Gotcha. So how far away do you think we are from that goal?
I think it can be done in a decade. With the right investment, it is definitely within reach. And the really tragic thing is that if we don't make those investments at current rates of progress, it will be 150 years before a baby born in Africa has the same chance of survival as one born in North America.
Wow. I didn't realize that is a staggering statistic there.
Yeah, we have to do this.
Absolutely. Well, I'm so glad to hear that you are working towards this goal and wonderful to hear that it's sort of within reach, which is amazing. So I think throughout your career as a scientist, you get advice from so many people and they help you along your career journey to get to this point of making amazing discoveries and breakthroughs. But is there one piece of advice that really sticks out to you, Rebecca, that you received that was so helpful that you want to pass on to our listeners today?
I think the best piece of advice, and I've had to get it at several points in my career, is to really think about where your heart is in terms of what you want to do and find a job that aligns with that. Because I think if there's a mismatch between those two things, it's very difficult to be happy and to feel like you're doing the work that you are meant to do. And I think every time I've been in a situation where there was a mismatch, I've had to step back and sort that out.
Definitely. And it sounds like you were able to find that match relatively quickly or relatively early on within your scientific career. So do you have any advice for people who might be looking for their perfect match of how you did it?
So I think it really helps to be open to interviewing for a wide range of different positions. I remember when I was getting to the end of my PhD, I felt very torn between whether I wanted to go to industry or whether I wanted to pursue an academic career. So I just interviewed for everything. I interviewed for several industry positions. I interviewed for a couple of postdocs. I interviewed for faculty jobs at research-intensive universities and at teaching-intensive universities. And I looked a little schizophrenic, actually, I think, in terms of what I was pursuing. But in some ways, it wasn't until I went and I put myself in that situation that I could say, boy, now I know this is really not for me. Mm-hmm. So for me, I have to just have that experience, I think, to know in my gut what is the right thing.
Definitely. And even having conversations with people in those fields, even if it's not necessarily a kind of formal interview for a job, but just maybe talking to people who have those positions might even open the window for you a little bit.
Yeah.
Well, Rebecca, is there any other last piece of advice or a last note of inspiration that you want to end our conversation on today?
We often forget, as scientists, you have the power to transform the world. And we need to take that seriously, and I think to be intentional in using that power.
Oh, I like it. Intentional. I think that's something we often hear people tell stories as a scientist of sort of things happen accidentally. You kind of fall into things, but I love this idea of being proactive and intentional about it. Well, Rebecca, thank you so much for sharing this message with our listeners and for sharing some of your stories today. Can you tell our listeners if they want to learn more about you and your work, where should they go?
If you go to our website, it is rice360.rice.edu.
Excellent. Well, listeners, definitely check out the website, learn more about the phenomenal work that Rebecca and her colleagues are doing there. And Rebecca, thank you so much for joining us on our program today.
My pleasure.
Well, it was a delight to chat with you, and listeners, wonderful to have you here with us as well. We'll see you next time on another episode of People Behind the Science. Your voyage to explore the lives of today's exceptional scientists has just begun. You can find everything we talked about today, including our guests' favorite books, biographies, photos, and more, when you visit us at www.peoplebehindthescience.com. I look forward to chatting with you next time on People Behind the Science.